A lot of abdominal problems can feel similar, but when it comes to pancreatitis, there's a specific pattern behind it. And once you understand that pattern, the symptoms and treatment start to make sense. At a basic level, the pancreas has two main roles. It helps regulate blood sugar, and it releases digestive enzymes that break down food. Normally, those enzymes are inactive until they reach the intestines, but in pancreatitis, that process breaks down. In acute pancreatitis, those digestive enzymes become activated too early while they're still inside the pancreas. So instead of breaking down food, they start breaking down the pancreas itself. That's what causes the inflammation. This is the exam gold. The most common symptom is epigastric pain. This is pain in the upper middle abdomen, and it often radiates to the back. Patients may also have nausea, vomiting, and the pain is usually persistent, not something that comes and goes. Now we're going to talk about the lab values. These are very high yield. Elevated amylase and lipase. Lipase is more specific one for pancreatitis. So when you see abdominal pain plus elevated enzymes, that should point you in this direction. Two of the most common causes are gallstones and alcohol use. Gallstones can block the flow of pancreatic enzymes, and alcohol can directly damage the pancreas. These are different causes, but the same result: inflammation. Here's the nursing priority. The main goal here is to rest the pancreas because the more it's stimulated, the more enzymes it releases. Here's your key interventions. So you'll see things like NPO to stop stimulation of the pancreas, IV fluids to support circulation, and pain control. Sometimes also NG tube insertion if there is severe vomiting to monitor for complications. This all ties back to the same idea. If enzymes are causing damage, you want to reduce enzyme activity. So by keeping the patient NPO, you're limiting stimulation of the pancreas. To bring it all together, when we step back, this is the system. The enzymes activate too early, so the pancreas starts to break down. Inflammation and pain follow, and everything we do is focused on stopping that process. Let's test this quickly. Pain in the upper abdomen that radiates to the back. What are you thinking? Pancreatitis. What are the key lab findings? Amylase and lipase. What is the priority intervention? NPO. This is one of those conditions where understanding the mechanism makes everything clear. It's not just random pain. It's a process happening at the cellular level. And once you see that pattern, the symptoms and treatment start to line up.